care are human-centered and not system or provider-centered as they've historically been. These models of care occur within the broader framework of drug policy in our country, which has always been rooted in racism. And so there really is no way to talk about improving care for people or what recovery looks like for people who use drugs without talking about racism. While racism is apparent across our country and our healthcare system, it is particularly evident when it comes to the space of addiction and recovery. Take the current overdose crisis, where often now the lay press coverage portrays a young white person who died from an overdose, framed as an innocent victim deserving of compassion. In contrast, historically, the response to past drug use and addiction crises among Black and Latinx communities has been mass incarceration and a racist war on drugs, which have provided modern legal cover for the same types of discrimination that occurred during the Jim Crow era. Rather than seeing substance use through a lens of compassion, drug use amongst Black Americans has even been used to explain away police killings, as we have seen with George Floyd's autopsy report, the killing of Daniel Prude, and the type of warrant that led to the killing of Breonna Taylor in her own home. To face the daunting challenge of reimagining these oppressive structures, policies, and systems, and to guide us in a vision for building an anti-racist recovery movement, we are so fortunate to have two amazing leaders in the space of addiction treatment, science, policy, and advocacy here to speak to us today. Tracie Gardner is a graduate of Mount Holyoke College and currently serves as the Vice President of Policy and Advocacy at the Legal Action Center, where she directs their major initiatives and fosters strategic partnerships. She has deep expertise in the areas of substance use, the criminal legal system, and HIV and AIDS. Tracie has more than 30 years of experience in public health and public policy work, and she previously served as the Assistant Secretary of Mental Hygiene for New York State. Dr. Ayana Jordan is a graduate of Hampton University. She completed the MD PhD program at Albert Einstein College of Medicine and psychiatry residency and addiction training at Yale University. She is now an assistant professor at Yale and a physician scientist powerhouse, committed to developing, implementing, and evaluating models to increase access to addiction treatment services within and in partnership with the Black community. So thank you all for being here today. With that, I'm going to turn it over first to Tracie and then to Ayana. And please feel free to chat in questions. We'll try to collate those for Tracie and Dr. Jordan at the end. Thank you very much.
Okay, is the screen being shared? Okay, great. So wow, this is fantastic. My name is Tracie Gardner. I am so pleased to be here. You know, Recovery Month is not new, but it's also not that old. And, you know, I think that there's many definitions for recovery as there are people in it or their understanding, but certainly it has been embraced as a way of, I'd like to think, talking about being able to live and thrive in the aftermath, so to speak, of problematic drug use, which includes alcohol. And so I've been talking about race and health for almost my entire life. I actually was very interested in the issues that people didn't want to talk about. So that included sex and that included drug use. And it was also the issues that people in my family didn't want to talk about. They had very problematic experiences with healthcare, whether it was for prenatal care, whether it was to be treated for substance use disorder, whether it was treatment of cancer that just took my father in April. And I can safely say, you know, the healthcare system that we know it, as we know it, was not constructed for Black men. It wasn't constructed for Black people. And so as we talk about recovery from substance use disorder, we can't have that discussion without understanding the larger framework in which we even come to understand substance use disorder, come to understand how it is an issue a phenomena where Black and brown people, but particularly Black people, given our history in this country, have been othered and criminalized and oppressed. And so law and policy is infused with those attitudes and with those objectives, if you will. White supremacy is the water in which we all swim, right? Without knowing that we're swimming in it, and it impacts everything. I come to this work because the personal is political. I am a Black woman doing advocacy work for 30 years around health emergencies affecting family members and Black communities in which I grew up. I am a Black woman in recovery, and that means that I have been, as I've been many times professionally, in spaces where I'm one of few. And I am a Black woman in recovery working in both the advocacy field, but having had the experience of working in the upper echelons, if you will, of decision making, which is the New York State Governor's Office, working on issues having to do with the overdose crisis and not able to disclose that I was in fact a person in recovery from drug use. And so the dissonance of that experience is very much about my experience over 30 years of doing this work, where I am both the community, if you will, I'm both the oppressed, and I am allowed to be part of the advocacy and the policy making that impacts my life. My background in particular, my social lens, if you will, was formed very much by the HIV epidemic and understanding that HIV as a health crisis was certainly not a new one that landed disproportionately and destructively on Black and brown communities. And I generally like to say Black communities. I know that Black and Indigenous people of color, we've all been harmed, white people as well. But the unique experience of Black people in this country is what informs both, as has been coined, the medical industrial complex, the prison industrial complex, the not-for-profit industrial complex. And in all of that framework is the idea of a people who, by virtue of their skin color, needed to be controlled, criminalized, institutionalized, and wiped out. And despite all efforts to do so, we persist, we endure. So Recovery Month is kind of bittersweet because it's really been around since, say, 2008, which also coincided with the kind of awareness discovery, if you will, that addiction can happen to good, innocent white people through the prescription drug epidemic. But we've always dealt with an opioid epidemic, if you will. There was an opioid epidemic in the 70s, and the response to that was harsh sentencing laws, like Rockefeller drug laws, long prison sentences for people suffering with substance use disorder, and the destruction of whole communities because of those criminal justice and drug policies that sought to scorch earth in its approach. In that as well, we allowed the healthcare system to abandon responsibility for the health of the mind. and we relegated them to institutions, the correctional and mental hygiene. My experience of working in the governor's office was finding out that in statute, there existed a Department of Health and a Department of Mental Hygiene. The Department of Mental Hygiene was broken down into offices for substance abuse services, mental health, and for people with developmental disabilities. And there is an historic reason for that, and it is not unique to New York. Just about every state has mental hygiene laws. Even the term mental hygiene implied, you know, a undesirability and a dirtiness. And so we have institutionalized and created whole systems that separate the mind from the body. And we have been able to then also separate the people who we don't want to treat versus the people we want to treat. We have in this country a ridiculous hypocrisy about what's illegal and what's illicit, I should say, and licit drugs. And again, it is part of the effort or the manifestations of white supremacy to create an oppressed other. And then, and I say this somewhat tongue-in-cheek, but not altogether, that the entire addiction treatment system, as it's been constructed, certainly since we've had mental hygiene laws, since we've recognized what is quote unquote addiction, needs to be thrown out. It is infused with criminal justice as its primary focus. It is not evidence-based, except for in the realm of opioid use disorder. And we are still very much operating in a 19th century approach to people who use drugs. And so there is, we are not integrating it into health because, quite frankly, health doesn't want it. And if it did, then we would not be having these separate discussions about quote unquote behavioral health or substance use disorder health or the overdose crisis. It would all be part of the whole body integrated health approach. As a person in recovery, and when I was trying to come into recovery, I was assaulted by the drug treatment system, the child welfare system, and the health system. All three treated me like I was broken, criminal, irredeemable, and a danger to my children. And so that, my experience was certainly not unique. And the idea of me being able to embrace my recovery from active drug use is, it's not shared. It's not truly shared. The expectation of my abstinence, for example, was conditioned on whether I wanted my children back in my life. And the idea that my children were faring poorly without their mother in their life, who had a health issue that affected the full family, was completely foreign. So even if we address racism, anti-Black racism in healthcare, in addiction care, in the criminal legal system, there are other systems that have taken the cues from the original racism of healthcare that continue to have those criminalizing elements totally infused. And so the work to dismantle and replace is only now beginning. I would also like to talk about what I have been and colleagues of mine have been talking about as Black harm reduction. It's about Black recovery, Black harm elimination, Black lives, and understanding the impact of various policies on Black communities. So Black recovery and Black harm reduction isn't just about drug policy. It's about acknowledging the web of harms done to Black communities in this country. And, you know, anti-Black sentiment is all over this world, but we're talking about the United States. And this idea of Black recovery seeks to address the oppressive systems and how they are woven together to keep communities broken, keep communities disempowered. Whether that it goes all the way to voting, it goes to our educational system, it goes to the environmental issues and how they impact our health. The overlay of COVID is exactly, or the mapping of COVID, if you will, maps exactly to, in many places around the country, HIV, prison admissions, low high school graduation rates. It's a system, cross-system assault on Black communities. And so, you know, we talk about recovery, and that's about embracing this life, right, without the oppression of drugs, but it's also about recovery from what? Recovery to what? The assumption that you recover and gain a life that allows you to live and thrive and be a useful and contributing member of society assumes that that was accessible to you prior to your drug use. We don't ask why people use drugs. We simply see them as drug users, and we deep down don't believe they ever can get well. We deep down speculate on what kind of drug it is that they've used to bring them into recovery. And so those are the biases that really impact then how we care for people who use drugs and the communities that we come from, and what our commitment is to really create a framework where everyone can thrive but acknowledging the systemic and deeply embedded historical racism. I want to leave a lot of time for Dr. Jordan, because I delight in following her on social media, and the framework that she brings to understanding, you know, kind of where we are in 2020 with, you know, this recovery month is particularly resonant given everything that's going on since the beginning of the year. And so we really, both Ayana and I really want to have a chance to answer some of your questions and dialogue with you about, as we move to future recovery months, if you will, and understanding that we cannot go back to pretending that we don't know the role of racism, anti-Black racism, and white supremacy in the substance use disorder field as it impacts people who are Black and brown, who are coming into recovery, accessing these systems. We can't go back and pretend that we don't know. So we want to have a dialogue with you about how we all move forward together. And with that, I'm going to turn it over to Dr. Jordan.
Woo. Tracie, listen,
Listen, girl.
Spirit, you have laid the foundation to guide me to continue. I am so grateful for you, Tracie. And
you listening to this?
Listen, I don't think MGH didn't know what they were doing when they got these two Black women together. But let me tell you something. This is a different kickoff. You hear me? I am here honoring the lives of George Floyd, Breonna Taylor, whose murderers still have yet to be arrested. Daniel Prude, who have all been murdered as a result of anti-Black racism through the guise of policy named as the war on drugs. And Tracie made it so plain to me that I really could just stop and open up the field to learn from her. But because I am so grateful to share this space, I will offer what I have to this space. But let me tell you something. When I was meeting with Tracie earlier, we had a little lunch. She said her age, and Tracie, I'm not going to share. But that truly said, Black don't crack, because there's no way that she's been doing this work almost as long as I've been alive and still looks so good. So sister, I say thank you. I literally am because of you. I'm standing on your shoulders and feel deeply moved to come after you. And the Lord knew, I'm a spiritual person. So at first it was going to be me, then you, but the Lord knew that it needed to be you, then me. So thank you, MGH. Thank you, Sarah. Thank you, Marty, for inviting me. I'm gonna go ahead and share my screen. Woo, child, I just didn't even know. Okay. Can you guys see that? Yes, no? You guys have to talk to me. Yeah, take yourselves on mute, talk to me. Okay.
Yes.
All right, thank you. So shout out to the folks that are here from my community, my mentees, two amazing Black women, Jessica Isom and Myra Mathis. Myra said, Ayana, I invited my whole clinic, my community from Yale, Charlotte's here. Shout out to Patrick. Shout out to all the folks that are here and didn't go to Immersa. I hope it's worth your while. We appreciate you. As Tracie already stated, of course, Black, Indigenous, and other persons of color, their lives matter. But the reason why we are even having two Black women kick off Recovery Month is because Black lives matter. They're shooting us in the streets. They're not honoring our humanity. And so we have to be very clear that in the pain of Black lives, as a result of what's happening, that's why we're having these anti-racism movements and discussion. So when I focus on Black lives, know that there's liberation for all BIPOC folks. But the reality is it comes at a cost of our lives. So Black lives matter. We are entering together, and maybe you all didn't realize, but I hope you know we have gathered into now a liberated space. And those who've heard me talk before, I always say, there is no safe space for me until my people are free. So with that, I ask for a curated, liberated space in which we can talk and share. We can disagree, but often in that conflict comes learning and healing of what we need to do differently. So I ask you to please join in not a safe space, but a liberated space so we can talk openly about the harms, what needs to happen, and how we move forward. I always say, I have to disclose, I'm a member of a national association, and I'm speaking for myself. Maybe one day I can speak for professional organizations, but here I'm speaking for myself. I start off with a quote from Huey Newton. He says, Black power is giving power to people who have not had power to determine their destiny. And I say that because what Tracie and I are trying to enter into the consciousness is, can we create environments that are vastly different from the white supremacist culture in which we live? And I'm going to give you some definitions of what I mean by that, right? But can we create existences, environments in which Black people can actually lead their own destiny? about what happens to them, and their very existence is not criminalized, and the way in which they want to receive care and how they want to inform recovery is actually led by them. Can we imagine that? And for those who are committed to recovery movement, how can you work so that everyone can be in charge of their own destiny? Some objectives, and I might not get through it because there's a lot that I need to do. I do want to be able to give some language to what we're talking about so people understand what we mean by racism, understand what we mean by white supremacy. I'm going to go through that. Tracie already went through some political and structural factors, but then I'm going to get to how do we begin to operationalize Black voices in the recovery movement, and just give you a teaser on how you can do this in your own neck of the woods, in your own neighborhood, so you can actually start to have some tools about what this will look like. This is from esteemed scholar Dr. Jones, thinking about what is racism and understanding that it is truly a social construct. There's no biological determinism, right? But we have to understand that even though it's a man-made system, it really is a system that structures opportunities and assigns value based on the social interpretation of what we call race. So even though we know it's made up, the bottom line is that it still advantages others, usually white folks, and disadvantages BIPOC folks. Okay, when I say BIPOC, Black, Indigenous, persons of color, but again, as Tracie said, we're going to center on Black lives. So then, what is happening? I can't move forward. Okay. I wanted to break down racism even more, and it's important to think about this because we know that racism is at play in all these different ways, right? At all these different levels. And so I want you to begin to think about in your own environment, how can I begin to become anti-racist? In which level of the system do I want to interact? Because Tracie already said, white supremacy is the system, the water in which we live, swim, air in which we breathe. So then you have to break down, how are you going to engage in terms of making this recovery movement anti-racist? You have to understand that there's different systems at play, right? So we know institutionalized racism, policies, this is Kamar Jones' work, differential access to the goods, services, and opportunities by race. Tracie talked about that. We see that in terms of housing, education, employment, income. Personally mediated racism, differential assumptions about the abilities, motives, and intents of others. So when you're having a Black person come into the addiction clinic already thinking they're not a good mom, their child should be taken away, that you need to report them, that they're not deserving of care, that you can treat them anyway. This is an example of personally mediated racism. So understanding, in order to conjure an anti-racism movement, recovery movement, how are you going to intervene on a personally mediated racism front? Internalized racism. This has to be discussed when you're thinking about recovery. If someone has been so stigmatized by the intrinsic negative messages about their own abilities and worth, like Tracie said, what are they recovering from and to what? There's absolutely reason for Black folks to want to use substances when your very reality is more painful than recovery. Can we talk about, you can't have recovery without understanding racism and internalized racism, because if I have nothing to recover to, and you're not providing me any clear depiction on what I can be, then why would I recover? It doesn't make any sense. So let's focus on the system and not the people who are victimized by internalized racism. Okay, so we got institutionalized, personally mediated, internalized. So then let's go to structural racism. And I say this sits at the umbrella. This is over all of it. And I need to break it down in GH for you today, because I hear a lot of times people want to be anti-racist and don't even understand that structural racism is different from institutional racism. Okay, so that's why I'm taking the time today to break it down. Structural racism embodies all of it. Those are the public policies, what Tracie was saying, the racist policies that have led to Black folks being criminalized for using the same substances that white folks been using and continue to use. We got Black and brown bodies still locked up while white folks are getting rich off of cannabis. Somebody say it. I grew up in a Black church, so I'm just gonna say amen. Somebody hear me, NGH. Take yourself off.
Amen.
Thank you. Thank you.
Amen.
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 So how can we talk about anti-racist recovery if we don't even understand the depths of the policies? What are you going to do about it in terms of reparations, just in terms of reparative work, so that when you are thinking about your recovery group, how are you going to speak truth to power in terms of how you're going to do the reparative work needed to be able to undo harm as a result of these structural racist policies, okay? White supremacy. When we're saying white supremacy, we're not trying to make white people feel bad at all. We're just speaking truth to power, meaning this is an ideology that white people and the ideas, thoughts, beliefs, and actions of white folks are superior to those of Black folks. And we all have been affected by white supremacist culture. I don't care who you are. And so we have to dismantle white supremacy, meaning dismantle those ideologies, right? In the ways in which white supremacy shows up. For instance, there's an assessment that I have from the Centers of Community where they talk about, can you do an assessment of ways in which white supremacy shows up in your recovery movement so you know which ways you need to intervene? Like, why all of a sudden do we have to have all these anti-racism task force without any resources? That doesn't make any sense. Right? This is how white supremacy is showing up. You have to have a solution without understanding the very foundation in which the solutions need to sit. How are you going to have an anti-racism task force and you don't have any membership from the very people that have been harmed? It doesn't make any sense. You need to slow down and do the preliminary work in order to get people into the recovery movement that can actually sustain the effort. Okay, guys, I'm not going to spend a lot of time here, but I just want to say, and this is really through the work of Courtney Cogburn, another Black woman that I met, amazing sister. She talks about not convincing people that racism exists in addiction and in recovery movements. Like, we're past that. So this is when folks need to do their own, journal clubs. Sarah was talking about some initiatives that SUDS has in terms of people learning and doing the work. You got to do your work and just know that I am not in the business of educating the majority anymore that racism exists. It exists. It shows up. A lot of people want to tote AA, and that's fine if that is ways in which people have sustained their recovery, but don't look down to other people who don't agree with AA, because it was founded and created by two white men, Bill Wilson and Dr. Robert Smith, to center the values and experiences of white men. So that can't be the only option when I'm dealing with poor Black and brown folks, when you want to send them to AA and they're saying no. But then if they don't participate in AA, then they have to go back to their probation officer. That is racist. It's harmful. So what I have tried to do in terms of, what did Tracie say? She said, the personal is the political is personal. What I've tried to do as a Black woman is to say, no more. My people have suffered. They continue to suffer. I am deeply affected by this. And what can I do in terms of my research, activism, education, in order to center the experiences of Black people and think of a different way in recovery? What can be done? Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. MGH community, you gotta be willing to sacrifice something in order to do anti-racism work. Is it going to be how people view you? Is it going to be your time? Is it going to be privilege? Is it going to be resources? But you have to do something differently in order to develop an anti-racist recovery. It requires action. Shout out to my mentee, Jessica Isom, for putting this on my radar. This is a nice graphic in terms of how do you develop an anti-racist recovery movement? What is it going to take? On the left is the fear zone. And you have these concentric circles that go out to the growth zone. So in the fear zone, we have people that say, racism isn't a problem. Why do we have to talk about it? Everything's okay. Everybody's welcome in this recovery space. When we know that's not the truth, and how do you move along this to get to the growth zone of educating your peers in the recovery movement of how Eurocentric racist paradigms or groups can be harmful to other experiences? How do you really begin to engage in this work to have an anti-racist approach? Starting with a few suggestions from the Community Catalyst group. They say, BIPOC voices cannot be excluded from the recovery narrative. It is unacceptable, it's hostile to consider yourself providing anti-racism recovery when you have no BIPOC voices. If you don't know how to develop those partnerships, then you need to do some more work, that foundational work that Tracie did for me before I start talking. You've got to figure out where are the BIPOC folks in your community that can provide some consultation so that they can be on your board, right? Thinking about how you might be able to partner with Tracie's organization to think about how can BIPOC leaders and organizations be involved in every single stage of policy development and implementation related to recovery. So it's not enough for you to say, I don't know. You've got to form those relationships, right? Really going a step beyond and emailing that author from your journal club to see what can I do to understand what work has already been being done in BIPOC communities by BIPOC leaders. Because another thing is, I want you to know, Black people, Latinx people, we didn't just become hip to anti-racism. This has been our lives. We've been doing this work. So we've been out here. And so just because you've been new to it doesn't mean that our work hasn't been existing. And so thinking about how you can partner with many Black people who've already been doing this work to see how you can promote a more inclusive recovery space. Then I've already touched about this, but understanding that health programs have to remove current and historic barriers. People always think, okay, slavery happened, get over it. No, I can't get over it. Because the bottom line is the sequelae of slavery still remain, right? So you still want to call the police. I'm going to make it very plain for you. You still want to call the police, knowing that police involvement escalates the risk of violence towards Black bodies. So if we're talking about anti-racism recovery approaches, we have to think about community action or effort to helping keep Black people safe when they're using drugs. This is what happened to Daniel Prue. His brother thought he was doing the right thing because he was taught to call 911, and that ended up in his brother being killed. So it's too much, the risk is too high to have police involved in anti-recovery movements, anti-racist recovery movements. We have to think about more creative options. And if you talk to Black folks, they already have been doing this work because it's been informed by their daily existence. Okay? Are y'all with me? Somebody say something. please.
We are with you.
With you and listening.
100%.
Amen.
Thank you.
Keep going, Ayana. Keep going.
Thank you.
Thank you.
Fantastic.
I'm feeling
Doing
it.
it.
It's
You're
hard,
doing
y'all.
it.
It's hard.
Woo!
Thank you. It's hard, you know? I just, you know, it's hard. And I'm trying to do the best I can on Zoom, but the energy helps to sustain me.
Just keep talking. It's so great.
Amen. Thank you. Thank you. Thank you.
Don't slow down. Don't slow down.
Don't slow down, Patrick. I hear you. Okay. So I'm trying to move on from this and I don't know what's happening. Oh no. It won't let me.
Ayana, maybe try stop sharing and, oh, there you go.
There you go. So how do we operationalize movement in the areas I just talked about? We have to understand that so much of it is focused on opioids. Okay, opioid crisis. White folks are dying from opioids now, although there's been drastic increases in terms of the growth rate for Black and Latinx people who are dying by opioids. But yet we continue to focus on white folks who use opioids, which again, it's not an either or, but understand that while you functionally ignore someone else's experience, they are not receiving help, they're not receiving care. I work with Black folks who don't even understand that they've been using heroin longer than I've been alive, and they don't realize that heroin is an opioid because so much is focused on opioid use and opiate pills and oxys, and they're like, oh, this is for me too? So even the way in which we use our language to express what's going on has to be anti-racist. Using the language in which people understand that they are a part of something where they can get help for. Another thing that Tracie talked about was basically what was happening with racist laws that led to, right, disparate rates of Black and brown communities in jail related to cocaine use, crack formulation versus powder cocaine. So again, we have to understand that's not just opioids. Cocaine kills more Black folks than opioids do, but that's not on the front page news. We're not talking about that. So when you're thinking about anti-racist recovery movements, are we focusing on how we might help folks with cocaine? We don't have the medication, but does that mean that they are not worthy of being in a recovery movement? What about the increase in methamphetamine? Right? So understanding that even the lens in which we think about substance use is intentionally co-opted by the experiences of white folks. Again, white supremacy. And how can we dismantle that so that we're bringing in the experiences of all people who use substances? All right, I gotta hurry up because I was like, we were going to talk and I got 3 minutes. So now I'm gonna move into, okay, Ayana, what do you do? What is the work that you do? And the work that I do is really centering the importance of BIPOC scientists who are committed to doing the work that intentionally focus on Black and brown people. And I was sharing with the group that we were having lunch with, it hasn't always been easy for me as a Black woman who wants to take care of Black people because I couldn't get funded. I couldn't get papers published because the very system didn't value Black lives. I was literally accused of being racist for wanting to study the experiences of Black people. And we see that this is not just something that has happened in the past. It's happening today. Race, ethnicity, and NIH Research Awards. This was published in 2011, talking about the racism that exists in our very research funding agencies. Topic choice contributes to the lower rate of NIH awards to African American Black scientists. This is important, guys, because we know, and they even state in their paper, that BIPOC researchers are more likely to focus on topics that disproportionately affect URM populations. So we can't even talk about anti-racist recovery movements if we don't think about how can we do advocacy to make sure that our own tax dollars are adequately being funded to support scientists who are going to study what needs to happen so that the treatments that we come up with actually reach the minority populations. You understand? And so when you have the director of the NIH that can say, what? Wow, this is surprising in his press release. Who would have known that there was a persistent funding gap for Black researchers? It's painful because it's like every Black researcher would have known. So we can't think about moving forward until there is acknowledgement of the ignorance by people in positions of power. And what are you going to do to now ensure that we are adequately funded to do our research? This is what we're talking about, reparations. All right, one of the things that I've been so grateful is to be a part of what's called the Yale Program for Recovery and Community Health. This is an academic community partnership, truly, that the guiding principles are: one, value of lived experiences, strength-based and culturally responsive. So no work is done here without understanding that from the very outset of the research design, there has to be BIPOC voices and people with lived experience involved in the implementation of this work. I'm very grateful to also work with a research mentor, Kathy Carroll. She's a white woman, but she's a true ally. She gets it in understanding that the evidence-based treatment that she came up with, which is a computerized-based program that's been shown to reduce use of many substances. She understands that the way in which it was being distributed to the community, it wasn't reaching Black folks. So what we did is we joined together to say, how can we provide this treatment in a more culturally affirming tradition? Because as Tracie said, she was assaulted from the very healthcare system that was trying to help her. So one of the ways that I've been thinking about anti-racist recovery movements in my own research is providing evidence-based treatment in places where people already feel safe. And for many Black people, not all, but for many, and there's research to substantiate that, that is within the tradition of the church. So this is just an overview of our pilot. It's just showing that we recruited folks, all Black, all who have various substance use disorders, not just opioids, and we wanted to see, could we pull this off in providing treatment in the church? Was it feasible? Was it acceptable? Did it have an impact on substance use? But also, if we broaden it to more terms of recovery, what about recovery goals? What about functioning? That's just as important if your urine tox is positive or negative. Like at the end of the day, I actually don't care. Are you able to go back to school? Are you able to have healthy personal lives? These are the things that we looked at in our pilot study. The bottom line is, spoiler alert, it worked. That's not a surprise to me. That's a surprise to NIH, but it's like Black folks were involved in this. We had church-based health advisors. They came in, they were welcomed by people in the church. Their humanity was affirmed. Remember we talked about the effects of internalized racism? We fed them. We opened with the affirmation, the scripture, we sang. You know, we had fun, y'all. Then they did the computerized treatment. We closed. And then all who wanted some more support, they had the option, it wasn't required, to be with the CHA, a church-based health advisor, at the end of the evidence-based treatment and say, can you pray for me? Can you pray for my mom? I'm having a tough time. So-and-so got shot and killed. The effects of police brutality are harming me. These are the things and ways we reimagine what treatment looks like. Okay, I'm gonna end with this, I promise, because I only got 6 minutes. Tracie, I love you, girl. I'm so sorry, but I will stop after this. I wanna talk about Imani Breakthrough, which is one of the most important projects I've been involved in. Imani means faith in Swahili. That was informed by the community members. This is Sherelle Bellamy, who I love. I couldn't do this work. Think about the power of representation. She's a Black woman, associate professor, person with lived experience. And together we're co-PIs on the Imani Breakthrough Program, which is a way to provide support as people interface with a very racist system. And those are the words that we use. We know that the traditional system in which you are going to enter is racist and can produce harm. We are going to help you through it. So what does that actually look like? It's a 6-month program. The first part is based on an evidence-based framework called the Citizens Project that was developed at Yale to say, we know that there are 5 R's that you need to enter recovery: roles, responsibility, relationships, resources, and rights. We're going to teach you how to restore your humanity in all of those areas. And just by having engagement in those classes, that has been shown to reduce substance use. But what we did is we went the extra step and we said, in addition to all that, we're going to provide you with wraparound coaching to check in on the goals that you set for yourself. All this is happening in the church once a week while you're also going to a traditional substance use program. We focus on the things that Tracie was talking about: your emotional wellness, your environment, your social support. There was a brother, and I'm sorry I'm forgetting your name, that MGH that I learned about, that he's getting people to vote. These are the things that we do in Imani, because we know, how are you going to think about recovery if you're not a part of the process of the representation of people who are supposed to represent your interests, right? And then at the end of that part, then we say, we're not going to leave you. We're going to continue. We're so happy you're in recovery. Now what we're going to do is we're going to work with you for 10 weeks to see how you're doing. How can we help you transition to whatever the next part of your recovery path looks like? Guys, I'm going to stop here. We ran out of time, but I'm going to stop with, in thinking about anti-racist recovery movements, we have to dismantle white supremacy, the belief that white people are superior to those of all other races, especially the Black race. If we start there, then that should inform all the decisions that we make. I have shared my slides with Elizabeth. She has the assessment of the recovery culture and this tool that you can use as a guide to figure out where you're going to start. I want to stop because I do want us to have some time. Thank you, MGH. Thank you, Tracie. Woo!
Thank you.
Thank you, Ayana.
Thank you so much.
Thank you.
Thank you.
Thank you. Ayana and Tracie, thank you so much. I'm going to post, there were just a few questions, a lot of other amazing comments in the chat that I'll share with everybody registered here, but I'm posting the questions.
I want to stop my share. I got to figure out how to do it. Because now I can't see where my, okay, here you are. Okay.
I can quickly mention the first question for you guys. When we demand BIPOC people are involved with policies, we get racist Black people being nominated to add to the racist echo chamber, like Clarence Thomas, Ben Carson. How do we pivot to strategies to counteract this attempt to dilute our anti-racist message?
Tracie, you want to take that one about basically trying to get BIPOC folks involved in the movement, and then the people that they nominate are racist themselves or suffer from internalized racism, using Thomas as a Supreme Court Justice Thomas as an example of someone who's racist?
Well, I mean, as an example of someone who's self-loathing and racist, I mean, it depends on what level, right? And that I don't want to say the vet process, but this is, again, we're probably going to say this over and over again. When people who are closest to the problem are the decision makers, are the nominators, are the outreach and engagement people, it will be authentic. It won't be the echo chamber. People like the Clarence Thomases generally get nominated by those who are in power, who are comfortable with that kind of representation, right? And so that's really a manifestation of that. Whereas, you know, if Ayana and I are going to advance, you know, say a national advisory on substance use disorder, you better believe we are not going to be advancing some oafy-doke, get along to go along, you know, kind of anti-Black person to represent the needs, right? And we know enough people who are doing the work, if we don't know them ourselves, who will advance those people. So some of it has to do with, you know, just who is actually doing the nominating at what level, but it really is like, does Clarence Thomas reflect, or a person reflect what is really going on and how to address the real issues, not the comfortable issues?
Yeah, amen. I don't have anything to add to that, for sure. Really being in community with the folks who may have been affected by internalized racism, but have done their own work, and now they're like, no. This is who you need to support. So that goes back to really being able to be in community with folks. Yeah.
Tracie, I was struck by your earlier description of your life, and because tomorrow I go on service, and service at Mass General is taking care of patients on the medical service, of which many of them will have substance use disorder. And it's very hard, you know, no matter how much you try to get your brain to work right, it's very hard to counter your brain and make sure you're not an agent of the said system that's, you know, destroying these people. And so I was curious, as you know, as I'm trying to work with my substance use patients, I'd love some advice from you in terms of, you know, your description of, you know, being in that space, worried about your kids, how the system was interpreting you, and how do we check that as physicians? Like, you know, how do we engage the patient themselves? And I guess ask them, what do you need, you know, on your way out of here? Because I think it is just so normal for us to be like, oh, you may hurt your kids, you don't have capacity. You know, we're throwing in all our little biases that we're worried about, that's sort of informed by other, you know, past racist structures.
Sure. And so, you know, I think you answered it, which is asking people what they need and then being prepared to respond to what they say they need. And so, you know, I guess now we realize that the opposite of active addiction is not abstinence,
right?
What was demanded of me in order to get my children, but connectiveness, right? It's like that, the rat given only cocaine and no enrichment kept choosing the cocaine. When the enrichment was put in place, which is a commitment, it's a commitment to resourcing people because you believe in their humanity. You see yourself, right? And that's a lot of what's going on, is that we have such a schism, a race schism, is that people, it's a function of white supremacy. You can't even see how we are the same. How you can't see my humanity. You can't see it. You know, you don't relate it to your life. And so that is a lot of what we have seen, is that in the aftermath of the prescription painkiller opioid epidemic, people discovered a treatment system and how it treated Black and brown people, and they decided they didn't want that. And that's what we're in the midst of, is changing substance use disorder approaches so that we don't have to be treated as Black people and brown people have been treated for decades of, you know, just in talking about addiction treatment system. If I hear somebody say behavioral health, I already know that they mean mental health and addiction.
Yeah.
They mean behavior that is the problem of the patient or the individual. And if that's the case, then we might as well put eating and sex and smoking and all the other and diabetes, all the other behavioral health issues that have to do with how people, I fundamentally believe, self-soothe. But just to get back to your point about how they saw me, the fact that I wanted to be with my children, but was still, I'm in a treatment program, but still struggling, their policy, everything is a nail. So everything gets hit with a hammer. And so understanding that there's nuance, right? That my children actually needed to be with me as we all healed, that my children were not being abused per se, right? Wide swath pain. My neglect and abuse was because I struggled with my addiction, not that I put my hands on my children. And I can tell you that many, many Black people involved in these systems are presumed to be the worst elements in their children's life rather than the best. Those extreme cases that hit the news are not the norm.
Yeah, and that talks about the ways in which, I mean, going back to the whole point of structural racism, the ways in which that larger media can really influence the policies that are set, right? Because the media hasn't been representing Black mothers who are in treatment or in recovery in ways in which that they can still take care of their children and still foster that commitment and safety while they are also going through the recovery path. What happens is this whole thing about, you know, Black mothers, welfare queens, abusing their thing. And so that's where we have to really intervene, because that enters the consciousness of these people who are setting the policy. So these are the things that I'm talking about, is like figuring out for yourselves, where am I going to intervene in terms of really creating an anti-racist recovery movement? Is it going to be in policy? Is it going to be holding the media to task? Is it going to be figuring out how I'm going to not perpetuate personally mediated racism in my own clinic? Like really being thoughtful about that.
Absolutely, absolutely. How did we figure out that the best thing for an opioid exposed infant is to be with its mom?
Amen.
Yeah. We didn't figure that out before. We didn't figure that out in the 70s. We certainly didn't believe that to be true for crack and cocaine. And let's be clear, one's a stimulant and one's an opioid, and I can go into a whole discussion about how we have centered so much around opioids because there are 3 FDA approved medications, because we want a one size fits all, take the medicine and be cured and be in recovery and be compliant and be a good person. It is not that way. Do you know how many women I've talked to who didn't realize that their relapses were influenced by their menstrual cycles? Like that in and of itself is not even discussed until you bring women together to be able to talk about that and the power of hormones. And of course I relapse every month, of course, but you're not gonna have that affirmed if you're in a system that sees you as out of control, your own worst enemy, your children's worst enemy, and someone to be contained and, you know, ultimately criminalized. Yeah. That's not going to happen.
Yeah.
That's seeing our humanity.
Yeah, amen. One of the things, sorry, and well, I'll shut up. Elizabeth, you want to go because I see that there's some questions there. But Rafiq asked a question about, Rafiq, you want to take yourself off mute and just ask your question because I lost it in the chat.
Sure.
Yeah. Thank you, Rafiq. We love you, a burgeoning scholar. Yes, go ahead, ask your question.
Yeah, I was just saying, you know, we're investing a lot of time and resources in training white practitioners and people who are new to this conversation, new to these topics. And sometimes I feel like that could be at odds with investing those resources into people, you know, like yourself, who already are kind of further along in this. And so I sometimes just get worried, are those two things at odds? Like, are we investing time in people who are new to the conversation and then leaving out those who kind of already get it and who are ready to go? Yeah, I'm just curious what you think about that. Are those at odds, or can you do both?
Yeah, so, you know, again, I really think just the either or approach is, again, really fundamentally rooted in white supremacist culture, realizing that you can do many things at once, and that there are many different ways to think about a solution to a problem, and how can you encourage people to collectively think about this. So again, it depends on your leadership. So I was very optimistic to hear about a brother, Joseph, I think Betancourt was his name, who's thinking about really maximizing resources at MGH to hopefully not have to make that decision about the either or. Like, yes, you can have white folks be able to do their work, and even Black folks and Latinx folks, because remember what Tracie said, we all are in this water, so there's all work to do. And at the same time, work for providing people with lived experience, peer recovery coaches, a fair wage, and understanding that they have to be hired with different qualifications. Again, they might not have a bachelor's, they might not have a master's, but they definitely have expertise in navigating a racist paradigm and being able to stay in recovery. So what does that equate for experience? And how can we bring them in and actually pay them in a way that we would expect to pay someone with a bachelor's? But again, that means that we have to reject the notion that the only way that you have value is through a certain educational system. So I think it's and, not or, but it depends on leadership. And it depends on people like you, Rafiq, quite honestly, pushing the system to ask those questions and say, why aren't we doing both? And who's responsible for making the decision so that we can get funding to do it all?
Exactly. It can't be zero sum.
Yeah.
And there's always resources available. I've never believed, for as long as I've been lobbying legislatures and Congress, there's always money. There's always money. It's about who sets the priority.
Right.
Who sets the priority and what they value. And we get to make them value differently. That's what's behind the defund police element. Not that we don't want police, but that the priorities for the vast amount of resources have been poorly prioritized. And we have to take control and understand that, which is why I'm a big fan of, you know, advocates, people with direct lived experience being advocates, understanding this policy system, because if we're going to dismantle it, we have to know what to replace it with.
Amen.
Right? So you have to understand it.
Yeah.
So first of all, Tracie, Ayana, this was an amazing kickoff. Thank you so much. You know, Ayana, you talked about the funding and the lack of funding for Black investigators. There is a lobbying organization called Research America. And one of the 4 officers is Al Reese, who's the dean of the University of Maryland Medical School and is African American. And I think that, you know, we ought to reach out to him and to Research America to make this one of the objectives of the organization in their lobbying with Congress and the Senate about funding for research for NIH. Because what you describe, unfortunately, you know, is absolutely true, that there is, you know, we would hope that in 2020 this would not be the case, but it is the case, and we have to be really proactive in trying to change the system.
Yeah, and that's when I say allies can really think about, like, you have that knowledge and you can really push that agenda, right? And say this has to be an agenda in terms of policy. There has to be increased funding. We need to look at the racist scaffolding that exists that literally allows for persistent gaps in research funding for Black investigators, even after you control for number of publications, where they went to school, so that we have to be able to say, what else is happening here and what are we going to do to prevent that? And so it can't just be Ayana, the Black researcher. It has to be Lauren and Isabel and Mauricio and Lael and Danielle being in your own internal places and figuring out how you're going to push that agenda and being very strategic about it and understanding that these are the conversations that are necessary even when it's not hip to say anti-racism anymore. So we talked about that a little bit. It's not growing weary, although you will be weary. So thinking about self-preservation in this work, because when it's not attractive anymore, when it's not cool anymore to be anti-racist, who's going to still be around to do the work? And so that really takes allies, because I can tell you, I get so exhausted. One of the things that I emailed to Tracie and also to Elizabeth when they talked about the increase in honorarium, and I'm just being very transparent, as I was like, great, because it is psychologically, emotionally, spiritually exhausting to be the only one talking about this. So we really need allies so that we can have an element of self-preservation to be able to renew our efforts. And if it's always just Black and brown folks, then we know, because they're not respecting our humanity, that it's not going to be taking us seriously. So that's why that's concentric circles that I showed you of how to become anti-racist. We need white folks to step up and be courageous in their efforts and be steadfast in figuring out what they're going to do and how they're going to continue the work when we're tired, when it's not cool. Shout out to Derry, who's been doing this before it was cool. She's a white woman and I have tremendous respect for her. Yeah.
Ayana and Tracie, do you guys have time for one more question, or should we let you go?
Absolutely.
Okay. How can institutions like government and hospitals make lived experience into a form of credibility and power without slotting people into roles where they always have to roll out their own traumas?
I mean, there's lots to say here.
Yeah.
It's just like heavy, but I think one of the things, and shout out to my fellow psychiatrists and psychologists on the Zoom, is really thinking about understanding the depths of the negative sequelae related to trauma, and really being able to take a trauma-informed approach to know that it can be re-traumatizing, and understanding how painful and deleterious it can be to the work if you are always asking someone to relive their trauma, right? And being able to focus on what other values. So this is a very important part of your story, but you're conceptualizing as you've gone through that trauma, now what lessons have you learned, and what is the value that you can add to the space without requiring that? And that takes people who really get it and understand that that doesn't have to be a part of the experience in order for them to still provide expertise in the space. So that goes back to, again, leadership, training, knowing folks who are doing work in this area and allowing them the prerogative to consider a different way in which peers are involved in the work, and including peers in that decision making as well. So again, it doesn't have to be that, you know, you as the white psychiatrist or even the Black psychiatrist or psychologist sets out the stage of what needs to happen, but from the very beginning, asking the pericoper, what would you like, what would you imagine this role to be? How can we think about centering value without having to relive your experience? For some people, that can be actually quite inspiring for some, but not for all. And then having the courage to realize that it's not a one-size-fits-all model, right? So again, these are things that happen that have to be modeled. I try to do a lot of modeling for my mentees so that they can see how just modeling and showing up in spaces differently allows other people to show up differently.
The only thing I would add to what Ayana talked about, which was exactly on point, exactly. as long ago as it's been since I've been involved with the child welfare system, my sons are 25 and 19, but there is something to be said about creating the community for people to be able to do that. And what I mean is, I know you want peers to be part of a community of peers. Don't, the isolated 2 or 3 who get to work with your integrated teams. They need their community and support. And so you're not having to spill your guts, your intestines every time just to legitimate a particular experience. That there is power in the herd, if you will. And what's real is that there are many organizations who do not want to deal with the combined power of people with lived experience.
Talk about it, Tracie.
They don't want to deal with it. They don't want to deal with the pushback. They don't want to deal with the demands. They don't want to deal with it. And so, but if you're just doing this kind of, we'll put a peer here, we'll put a peer here, we'll put a peer here, and you're not creating a support network. Ayana is my support network. I am hers. We're doing this kind of work. We are connected now, and she knows I've got her back and she's got mine. You got to create that for the people who are also doing this work that is educating you, as well as doing the translation of your work to the communities that you're serving.
Amen. Thank you for holding me, Tracie, because now listen.
You stuck with me, girl.
Listen, girl, emails upon emails upon emails. All right.
Stop.
Yeah.
All right, everyone. Ayana and Tracie, thank you so much for being with us today.
Thank you so much.
The emotional labor that it takes to do this, we're so grateful. And I will share this recording and the chat because it was an incredibly powerful chat, and want to make sure that you both and everyone else gets to read that. And again, thank you and for being with us today.
Thanks for having us.
Yeah,
thank you. Wonderful. Thank you.
Thank you very much.
Thank you.
That's wonderful.
Thanks, Sarah.
Thank you so much.
Thank you so much.
Thanks so much.
Thanks, Tracie.
Blessing.
Thanks so much.